This study was conducted to examine if ASICs play a functional role in control of lower urinary tract activity. We used the A317567, which is a non-amyloid blocker of ASICs. This ASIC blocker produces the most potent blockade on ASIC3, but also blocks ASIC1 and ASIC2. CMG parameters measured were as shown in this slide. This slide shows the representative picture of effect of IP injection of ASIC blocker or vehicle during normal saline infusion CMG. ASIC blocker increased ICI and PT, whereas the vehicle did not change these variables. After IP injection of ASIC blocker, blood pressure gradually increased following the same trend as the change in intravesical pressure from baseline as the infused volume in the bladder increased. However, after the infused volume in the bladder was greater than the volume at baseline, the intravesical pressure increased exponentially. As a result, BBC decreased. Compared with vehicle, the ASIC blocker increased ICI and PT and decreased BCP. The slide shows a representative picture of effect of IP injection of the ASIC blocker or vehicle during acetic acid infusion CMG. The ASIC blocker increased ICI and PT. The increased PT was due to increase of ICI. Compared with vehicle, the ASIC blocker increased ICI and PT. The slide shows a representative picture of effect of intravesical perfusion of ASIC blocker or vehicle during saline infusion CMG. As shown in this slide, the ASIC blocker produced no effect on the bladder activity. No differences are found between ASIC blocker and the vehicle in CMG variables measured. The slide shows a representative picture of effect of intravesical perfusion of the ASIC blocker or vehicle during acetic acid infusion CMG. As shown in this slide, the ASIC blocker produced no effect on the acetic acid-induced bladder hyperreflexia. No differences are found between ASIC blocker and the vehicle in CMG variables measured. The experiment using IP injection of ASIC blocker revealed that ASICs are involved in bladder afferent signaling in the presence or absence of intravesical acid irritation, exhibiting a contribution to urine storage function. ASICs do not participate in bladder contractility and bladder muscle tone. ASIC blocker given intravesically did not change the bladder activity either with or without intravesical acid irritation, suggesting that ASICs in the urothelium is not involved in bladder afferent signaling to modulate bladder capacity. A317567, an ASIC blocker used in this study, has been shown to display extremely poor penetration into the central nervous system, suggesting that it mainly acts on the peripheral nervous system. This study suggests that blockade of ASICs can be useful in treatment of urine storage dysfunction such as OAB and PBS. Thank you.